I'm Dr. Dobzyniak and I'm an orthopedic surgeon. My subspecialty training is in hip and knee replacement, and I treat disorders, arthritic disorders of the hips and knees. My main operations that I do are hip replacement surgeries and knee replacement surgeries. Hip replacement surgery is a surgery that's been done in the United States for years and years. It actually came probably in the late 60s. And the implants and the techniques have evolved, really made leaps and bound changes over the last several years. Since about the late 90s, a new way of doing hip replacement was brought to the United States from France, and the person that brought it to the United States actually studied in France under the inventor of the new way to do hip replacement, which is called the direct anterior approach to the hip. And the direct anterior approach to the hip is probably the only true muscle-sparing approach to the hip. And the reason that's important is because if you can do less to the muscles, the recovery after surgery is going to be faster. So no matter what surgery we do, our goal is to be less damaging to the muscle tissues, whether it be arthroscopic surgery around the shoulder versus a large open incision, or a smaller incision, less damaging approach to the hip. And because you do less to the muscles, in experiences of the doctors that have done it versus doing it the more muscular damaging ways, we've noticed much faster recoveries. So I think the advantages of the direct anterior approach to the hip is for the patient a much faster recovery. The typical course for a hip replacement done through the anterior approach is about an hour and a half of surgery, and then you spend a few hours in the recovery room. When you get to your room, the day of surgery, we have you get up and walk, so you actually will walk the day of surgery. It's not uncommon on the first day after surgery for people to be able to walk 300 to 400 feet and go up and down a flight of stairs. Our typical hospital stay, though, is 2 nights. So if you have surgery on Monday, you'd go home on Wednesday. And when you go home, you're very functional. So you can go up and down stairs, you can walk. At 2 weeks after surgery, most people are off their crutches or their walker. And when I see them back at 3 to 4 weeks, a large number are completely off of all assisted devices, and typically I can really not even tell which hip they've had done. So that's been the drastic difference, and that the recovery is so much faster. I think most people say that you need to do at least 50 of a procedure per year to be competent in it. We started doing the anterior approach about 3.5 years ago, and prior to that I'd been doing posterior hips for 10 years, so I've got well over 4,000 hips that have been implanted. Anterior approaches, I think we're getting pretty close to 500 now, and typically we'll do 4 to 5 a week, and that's been for the last at least 3.5 years.